Hey guys, my name is Audrey. I'm a dermatology PA, and this is a series of a day in the life as a PA working in derm. There are days when I'm really productive and I'm really happy, but there are of course days when I feel like a potato. So hopefully you guys enjoy this video, and if you like, subscribe and comment below. Having my water. It's my black coffee. And a croissant for breakfast. I love carbs. So I'm heading into clinic, and I usually start my first patient at 8, and I try to get there a little earlier. My front office staff, they're so creative with decorating our office with every month. So my doctor likes collecting cartoons if they're dermatology related, and so these two are my favorites. So one of the first things I do in the mornings is check my schedule, and I see who's coming in and what they're coming in for, and this just helps me get ready for the day. So in all of our procedure rooms, we have drawers full of supplies. So we have these blades for our transsectional biopsies. And here's our punch packs. We want to do a punch biopsy or pathology bottles. And there's different size punches. So punches are kind of this circular kind of cookie cutter tool to kind of get a small piece. So we can go as small as 2.5 millimeters. It's pretty small in size. I'm trying to focus in. We have, I think, at least a 10, 4.5, 5. I think we can go up to a 10. These are all little bins for our different procedures. They're well stocked in the rooms. This is pretty common, our punch packs. Got Addisons in there, scissors, suture scissors, needle holder, and gauze. These are for most days. Most packs, blade holder, gauze, my Addisons with teeth, Q-tips, dental rolls. My doctor actually trained with Dr. Frank Mose, which is pretty neat. And then our MAs have like nice photos to kind of show them what it looks like. One of our awesome MAs,
Hello.
Future MD.
Future MD.
Dr. Michaela in the works.
Just doing my daily instrument cleaning.
Just casually.
Casually.
Lots of instruments. These are one of our rooms. There's a nice light for these procedures. I have my own headlight, so that's really nice. And more commonly, freezing a lot of things, a lot of precancerous spots. And this is liquid nitrogen. You can also freeze off wart, seborrheic keratosis. You can freeze with this. But yeah. So in my office, we offer PDT light therapy, which is a way we can treat a lot of these precancerous lesions. We also offer UVB light therapy, which is narrowband light therapy, and this is commonly for lots of skin conditions, including psoriasis, eczema, vitiligo. This is our Mohs lab where we do different staining. And this shaves and cuts down the pieces. It's me. And of course, we have lots of samples. This is wonderful because we can get patients started on some samples, and this can get them through until they get their prescription from the pharmacy. live in a small studio and my lunch breaks are really nice. Here, I'm making some tomato soup that I cooked last night. I'm just heating it up. Should be good.
I love my air fryer. It helps me cook large meals throughout the week, and this is just sweet potatoes and broccoli with a little bit of truffle oil that I had for lunch. I also do lots of dictations throughout the day. This is really nice because there's less charting for me, but I always make sure I go through my physical exam and the plan and just put important notes so I know what's going on when the patient returns to clinic. I gotta stay hydrated, and so I'm always drinking water throughout clinic or coffee. So with any procedure I do in derm, which is all the time, whether it's a biopsy or an excision of a skin cancer, I put on my glasses for protection. We use sutures a lot throughout the day for procedures. On the left, those are some classic absorbable sutures, and on the right, those are some common non-absorbable sutures we use every day.
So we do a lot of surgery in dermatology, and we use this cautery tool. We add a bobby tip to this and just turn it on. This is one of my favorite rooms because of all the natural lighting.
And I'm back doing more dictations and typing some notes. I'm pretty good at getting this done before I leave home, and I think that's really helpful for my work-life balance. And that's the end of my day. I usually end clinic around 4:30 to 5, depending on how many notes I have to catch up on. So on the days my doctor does Mohs surgery, micrographic surgery for tissue sparing regions of the body for certain skin cancers, I can help with the closures for certain cases. A fun fact is that my doctor trained under Dr. Frederick E. Mohs, who created the Mohs procedure. We can sometimes have hospital consults, and these can vary from unknown rashes to various skin disorders, and this is pretty exciting. And lastly, we do some cosmetic procedures. In my office, we do Botox, microneedling, sclerotherapy, chemical peels, and some removal of facial telangiectasias using hand cautery.
All right, so that was a typical day as a dermatology PA. Really fun parts of my job is that almost every patient I'm seeing, I'm doing some kind of procedure, and not every patient's the same. So I can go from seeing a patient who has a history of skin cancers and doing a full body check to a younger patient who wants to come in and get their moles checked because they might have a family history of skin cancers, especially something like melanoma. Go from that to seeing a patient who's had a rash for many years and it hasn't been treated. I have to do a bit more thorough workup for that patient in particular, to even something like acne, and I even get to do a little bit of cosmetic procedures. I think the interesting parts of my day is that I get to see patients from all different age ranges. So I can go from seeing younger kids to older adults. Yeah, I think that's one of the really beneficial things about derm, is that your day is constantly changing and every patient isn't the same. So, you know, I think that flexibility and that fluidity really well with me, my personality. And so I unfortunately wasn't able to perform or show you guys any of the patient interactions or any of the procedures, but procedures are huge in derm. So I'm almost always doing a procedure with my patients, whether it's a biopsy, and there's different kinds. We can use a tool that looks like a shaver. It essentially is a transectional blade. That's the correct term. And we're able to shave a lesion off on that same plane. Or we can use a tool that looks like a small micro, like cookie cutter. The smallest size, like I mentioned in the video, goes to about a 2mm size. In our office, we can go up to 10 millimeters. And so we're able to use that to get more precise pieces and go a little deeper past that epidermis and even the dermis down to the fat sometimes. And so I think derm keeps you on your feet. You're never really bored, and I really enjoy it. I hope you guys liked the video. If you liked, please subscribe, like, comment below, and I'll respond back to you. And let me know what you guys want to see. And if you are trying to be a PA or you're interested in becoming a dermatology PA, don't give up. I posted a video about how I got into the field, and so make sure you check that out too. Bye guys.
She's a Mona Lisa. Everyone's lining up to see her. She's a Mona Lisa.